And so all that Bobby Kennedy is saying is, let us not claim that to know more than we know.
Correct. I very fundamentally believe, for instance, that the measles vaccine is quite important for child health. I've also heard Bobby Kennedy say that in the face of the measles outbreaks that have happened, that children should get the measles vaccine. That's not a man that's anti-vax.
Right.
What he said is exactly true, and this is every conversation I've had with him reinforces this. He cares about making sure that people understand what they're getting. And in the scientific community, because of their successful history of vaccines going back centuries, the scientific community treats vaccines with kid gloves. Nevertheless, the regulatory bodies of this country have an obligation to make sure that the products we recommend, especially children take, have a proven track record of safety behind them. And in many cases, they do. And in some cases, like the COVID vaccine for children as young as 6 months old, they do not. The fact is—
It's incredible to me, but those were rushed through without the usual FDA.
Normally, the safety testing of vaccines takes decades.
Got it, and we didn't have time.
Yeah, so I'm not trying to like indict anybody over this. I'm just a fact, right? So when in April of 2021, I wrote a op-ed with Martin Kulldorff, then of Harvard University, arguing that children should not be given the COVID-19 vaccine. Or not recommended, no, healthy children should not be recommended to get the COVID-19 vaccine. And the reasoning was there was a very limited evidence of benefit for children because they die of COVID at such low rates that you don't really have much to gain from the vaccine for kids. You're not preventing deaths. No randomized study had demonstrated prevention of deaths for children given the COVID vaccine. Right? That's not a randomized study, does not exist that shows that. And there was a possibility of risks, of side effects. So the benefit-harm balance tilted against recommending children to get this. Whereas like older people, there was, to put yourself back in early 2021, COVID was killing older people at very high rates. And there was some evidence that the COVID vaccine might prevent those deaths.
I know this, Jay, because you told me to go ahead and get vaccinated.
I got the COVID vaccine myself because I'm an old guy. So the balance was different for older people, right? So the right policy advice then,
based on the science,
yes, was no for children, yes for older people, especially for older people at a high risk with multiple chronic conditions that put them at high risk. That's a reasonable balance given the uncertainty.
And so all that Bobby Kennedy is saying is, let us not claim that to know more than we know.
Correct.